Hi there. Uh, One of the questions I most commonly get when I've set exercise rehabilitation for patients for an injury is how many reps and sets they should be doing. And this is kind of slight misunderstanding as to what I want from a patient. Um, I always feel that if someone else is telling you how many reps and sets you need to be doing, 10 reps three times a day, 10 reps, 3 sets of 10 reps or something, then it's totally arbitrary. That isn't exercise rehabilitation as it should be prescribed. Your rehab should be progressive. So what you can do on the first day you try and do rehab should be different to what you might do 1, 2, 3 weeks in. And the idea being that this gradually gets harder as you get stronger. And if it's not getting harder as you get stronger, you're not quite doing it right. So imagine if you're set 10 reps, 3 sets of 10 reps. Once you can do 3 sets of 10 reps, continuing to do 3 sets of 10 reps makes you no progress. You don't get any further. So the way I like to set this is patient decides how many reps they can do. Generally speaking, unless I've got good reason, my rehab is prescribed to be done once a day, not 2 or 3 times, remembering that you have to walk around on your foot and ankle for the whole day. So increasing the amount of rehab exercise you do is likely only to reduce the amount of daily life activity that you're able to do comfortably. That becomes a problem. But I'd stress to all my patients that their rehab should be hard, and that you should continue to do as much of your daily life activity as you can without spiking pain. What I would normally get a patient to do, what I'd ask them to do would be go away, have a look at the video of a particular exercise you were supposed to be doing, and attempt to see how many reps you can do on the first go. For argument's sake, you might do 10 reps. Then for me, you would then start your rehab program with 1 set, once a day of 10 reps. But my idea would be that day by day, you would increase this. So day 2, I would like you to do 11 reps. And day 3, you do 12 reps, 13 reps, 14 reps, gradually increasing it. Ideally, I feel, by 1 rep a day. Once you get to about 30 reps, we know that's probably the limit of any hypertrophic response. So you're not getting any stronger, that you move on to more difficult exercise. So we're not expecting a patient to have the same exercises, 1, 2, 3, 4 weeks in, they're still doing the same exercise. They're not gaining anything to keep doing that. So the idea being is you would then progress that, you have a more difficult exercise, and then you start your reps at a lower number of reps again. More difficult exercise, drop your reps down, attempt to go and see how many reps you can do on the first attempt, and then increase from there. Generally speaking, we don't give patients lots of different exercises to do. So my bias is towards giving you something that you can do quickly, integrate it into your day, and then forget about it for the rest of the day and go back and do it the next day and try and do a little bit more. The rehab exercise should be difficult enough so that it is slightly painful or uncomfortable to do. I think that is normal. We're not expecting you to be doing this in 10 out of 10 agony, but you should be able to feel it. And patients always say to me, "Oh, that's not working because my Achilles, for example, or whatever part we're trying to rehab, is more sore afterwards." Now, important distinction: if you're more sore afterwards, that's probably a good thing. All right, it's a good sign. But as long as those increase in symptoms don't take more than 24 hours to return to baseline. So let's say, for argument's sake, you're rehabbing your Achilles, you would do your exercises, right? And let's say you're 2 out of 10 before you started your rehab exercises. You finish your rehab exercises and that pain goes to 5 out of 10. Great. As long as it settles back down to 2 out of 10 by the time 24 hours has elapsed, then you're right on track. And for most patients, that's less than that. So most patients will get a slight spike in pain, settles within an hour or 2. that's perfect. That's a sweet spot. That's really the right intensity of exercise for you to be doing and producing an adaptive response. What that means is you're getting stronger. You're forcing your body to make an adaptive response and get stronger very, very gradually over time. Your recovery does depend on the intensity of exercise and your ability to recover, and that is also dependent on which tissue, which structure, tendon, ligament, bone, how quickly that takes to recover. They're different. A nice muscle with lots of blood supply will recover a lot quicker than a tissue that doesn't have a great blood supply. That depends on your injury. I hope this helps. Hopefully it helps frame what is expected of you with your rehab, and the likelihood is it's not going to take 1 or 2 weeks, certainly not for a lot of tendon issues that we often give rehab for. We're probably looking at measuring that overall recovery in a number of months, not days and weeks. Obviously, if you're having increased pain, you're attempting your exercises and the pain is building and getting worse day by day or week by week, you should return to clinic. Either have your rehab reframed or adjunct treatments to that can help you cope with the symptoms or speed up your recovery. They're useful. Hopefully that helps, and hopefully I won't see you again too soon in clinic.